Good morning. I'm Dr. Alex Mandell, and I need to tell you something that might save your life. In the next 20 minutes, I'm going to show you 5 warning signs that happen when you wake up, signs that most seniors completely miss that could mean your body is sending you a serious message. And what shocked me the most after 25 years of practicing medicine, these aren't rare. These happen to 1 in 3 people over 65. Some of you watching right now are experiencing at least one of them this week. But here's the thing. Your doctor isn't going to volunteer this information. The reason why, stick around because it changes everything about how you approach your mornings from this moment forward. Before we dive into what's happening in your body right now, hit that subscribe button and turn on notifications. This channel is dedicated to helping you live independently, feel confident, and catch health issues before they become emergencies. Over 180,000 seniors just like you get this information weekly. Let's make sure you don't miss the next one. The symptom. The first warning sign I want to talk about is something I call extreme morning dizziness. Now, I'm not talking about that little head rush you get when you stand up too fast. That's normal. I'm talking about when you wake up, your room is spinning, you can't focus your eyes, and sometimes you feel nauseous or off balance for minutes even after sitting down again. I remember speaking with a patient, let's call her Margaret. Margaret came into my office because her daughter insisted. Margaret said, "Dr. Mandell, I'm fine. My morning dizziness is just part of getting old." But it wasn't fine. Over 3 months, Margaret had lost her independence. She stopped going to water aerobics. She wouldn't visit her grandchildren without her son driving her. She became anxious about falling. What happened next surprised even her family. We ran 3 specific tests, vestibular function tests, blood pressure readings in different positions, and an inner ear imaging scan. The result, Margaret had BPPV, Benign Paroxysmal Positional Vertigo. This is treatable. Within 6 weeks of specific repositioning exercises, Margaret was back at water aerobics. She was hugging her grandchildren. That's the power of catching it early. Here's what most people don't understand. Extreme dizziness in the morning can be a sign of 3 different serious conditions. It could be your inner ear system failing. It could be low blood pressure when you wake up, which means your heart isn't pumping blood to your brain efficiently. Or it could even be a warning that your medication doses need adjusting. The point is this: your body is communicating, and that dizzy feeling, it's not normal aging, it's a warning message. If you wake up dizzy, here's what I tell my patients. 1, don't jump out of bed. Sit on the edge of your bed for 30 seconds. Let your body adjust. 2, if you're still dizzy after 5 minutes of sitting, that's worth mentioning to your doctor. 3, keep a log for 1 week. When does it happen? After which position? Which medications did you take the night before? This information is gold for your doctor. But wait, there's another morning symptom coming up that surprises even me when I see how often seniors dismiss it. And this one can indicate something far more serious than dizziness. Please take 5 seconds right now and hit like if this is information you needed to hear. Comment below what morning symptom concerns you the most. Your comments help me create videos that actually help seniors like you. And of course, subscribe so you get the rest of these 5 warning signs. The symptom most people ignore. Now let's talk about the second warning sign, and this is the one that scares me the most when seniors tell me they've ignored it. Chest discomfort or tightness that happens right when you wake up in the morning, and here's why it's tricky. It's often mild. It's not the Hollywood heart attack you see in movies. It might feel like pressure. It might feel like your chest is tight. It might feel like anxiety. Many of my patients thought, oh, it's just anxiety. It goes away in 10 minutes anyway. Why this happens in the morning. Your body has a natural rhythm. When you sleep, your heart rate is lower, your blood pressure is lower, your blood vessels are relaxed. But in the morning, usually between 6 and 9 a.m., your body releases a surge of stress hormones like cortisol, your blood pressure spikes, your heart rate increases. If your arteries have any buildup or narrowing, this morning surge puts sudden pressure on your cardiovascular system. That's why heart attacks are statistically more common in the morning. That chest sensation, that's not your imagination. That's your body warning you about a potential cardiac issue. I had a patient, let's call him George, 68 years old. George came to see me about something completely different, his knee pain. During the appointment, I asked my standard questions. George, any chest discomfort? He said, oh, nothing really, maybe once or twice when I wake up, pressure for a few minutes, it goes away. I did an EKG. I ordered a stress test. What we discovered, George had significant arterial narrowing in his left anterior descending artery. His family would have discovered him on the floor. Instead, we had time. He had a procedure. He's now 8 years out living independently with his wife in their home. What to do right now? If you wake up with any chest discomfort, here are your action steps. First, don't ignore it. I don't care if it goes away in 5 minutes. Tell your doctor. Second, note what makes it better or worse. Does it improve with movement or rest? Does it come with shortness of breath, with sweating? These details matter. Third, get evaluated. It might be anxiety, it might be acid reflux, it might be musculoskeletal, but it might be cardiac, and that's why you need a professional assessment. Most importantly, don't drive yourself to the ER if you're having active chest discomfort and shortness of breath. Call 911. Let professionals evaluate you safely. This brings me to the third morning symptom. And here's what's fascinating about this one. Most people experience it, but they think it's normal. Some of you in this video might wake up this very morning with this issue, and you won't even realize it's a warning sign. Seriously, if this is helping you understand your health better, share this with someone you care about. Send this to your daughter, send this to your sister, text it to your friend who always complains about waking up feeling terrible. And please, don't forget to like and subscribe. Let's get to 200,000 subscribers this month. The overlooked warning sign. The third morning warning sign is something I call morning brain fog, and here's how most seniors describe it. I wake up confused. I can't find my words. My thinking is cloudy. It takes me 2 hours to feel normal again. Now, many people think this is just normal aging, but I'm telling you, persistent morning brain fog is not normal aging. It's a flag. What's really happening? Morning brain fog in seniors can indicate several things. One, your sleep quality is poor. Your brain isn't consolidating memories or clearing metabolic waste during sleep. Two, you have undiagnosed sleep apnea. You're waking up dozens of times per hour without knowing it, so your brain never gets deep sleep. Three, your medication timing is off. Maybe you're taking a sedating medication too close to wake time. Four, you have inflammation in your brain, which could be early cognitive decline. Five, your blood sugar is dropping dangerously low at night, affecting morning cognition. The point is your brain is trying to communicate something. I had a patient, let's call her Susan, 73 years old. Her husband called me worried. He said, Dr. Mandell, Susan is forgetting things. She can't remember our grandchildren's names in the morning. Is this Alzheimer's? Susan thought she was losing her mind. Her family was terrified. But here's what we discovered through testing. Susan had moderate sleep apnea. Every night she was gasping awake without realizing it. Her brain was oxygen deprived for 8 hours. We prescribed CPAP therapy within 2 weeks. The brain fog lifted completely. Susan was sharp again. Her family saw the woman they knew come back. How to identify this in yourself? Here's the practical assessment. For the next 3 mornings, write down exactly how you feel for the first 30 minutes of waking. Can you remember what day it is immediately? Can you follow the news on TV or remember what you read? Can you have a conversation without losing your train of thought? If the answer is no, or if it takes more than 45 minutes to feel clear, that's worth investigating. Ask your bed partner, do I snore? Do I seem to stop breathing? Do I gasp at night? These are the clues. Then bring this information to your doctor. They can run a sleep study to see if sleep apnea is the culprit. Now, the fourth warning sign is something I see constantly, and it's one that seniors often overlook because they think it's just their body aging. We're halfway through these warning signs. Hit like right now. Drop a comment. Which of these symptoms have you experienced? And don't forget subscribe and ring that bell so you never miss a health video that could literally change your life. When stiffness signals something serious, the fourth warning sign is severe morning stiffness or pain that doesn't improve with movement within the first 30 minutes. Now listen carefully, I'm not talking about general muscle soreness from sleeping. I'm talking about joint pain. I'm talking about stiffness so severe that you struggle to get out of bed. I'm talking about pain that persists even after you've been up and moving for 20, 30, 40 minutes. Why this matters. Here's what most people don't know. Severe prolonged morning stiffness can be a sign of autoimmune disease or inflammatory conditions. I'm talking about rheumatoid arthritis, lupus, or other serious systemic diseases that seniors sometimes don't realize they have. Why does it happen in the morning? Because when you're not moving, inflammation builds up. The longer you sleep, the more inflammatory markers accumulate in your joints. If you have an underlying inflammatory condition, morning is when it's worst. I remember speaking with a patient in her late 60s, let's call her Patricia. Patricia woke up every morning in severe pain. Her hands were so stiff she couldn't grip her coffee mug. Her shoulders ached, her hips ached. Patricia had convinced herself it was just aging. This is what happens when you get old, she told me, but it wasn't normal aging. Her morning pain was lasting 2 to 3 hours. We ran some blood tests. Patricia had rheumatoid arthritis. Early detection is everything with RA. We started treatment immediately. Within 3 months, Patricia woke up and the severe morning stiffness was gone. She was getting back in the garden. She was playing with her grandchildren without pain. That's the difference early diagnosis makes, what you need to track. If you experience significant morning stiffness, here's what to monitor. How long does it last? Is it more than 30 minutes? Is it getting worse? Does it affect the same joints every day or different ones? Is your pain accompanied by swelling, redness, or warmth in the joints? Do you feel fatigued or feverish? All of these are pieces of information your doctor needs. Bring a journal documenting your symptoms for a full week. This changes how your doctor approaches diagnosis. We're getting to the fifth and final morning warning sign, and this one is the most commonly missed by seniors. Some of you might be experiencing it right now without realizing how serious it could be. We are almost to the fifth warning sign, and honestly, this one changes how you need to approach your mornings. Before we get there, please do these 3 things. 1, like this video. 2, subscribe and enable notifications. 3, share this with someone who needs to hear it, a friend with health concerns, a family member, someone you care about. Ready for the 5th one, the most overlooked warning sign. The 5th and final morning warning sign is something many seniors dismiss completely: shortness of breath or extreme fatigue that hits you as soon as you wake up. And I mean real shortness of breath, where you feel like you can't catch your breath, or where simple activities make your heart race and you're breathing heavy. Most people think, oh, I'm just getting older, my stamina is decreasing, but that's not what's happening. What this indicates: morning shortness of breath and fatigue can indicate several serious conditions. Your heart might not be pumping blood efficiently. That's heart failure. Your lungs might not be oxygenating your blood properly. That could be COPD or pneumonia. Your blood might not be carrying oxygen. That's anemia. Your thyroid might be failing. That's hypothyroidism. Your blood pressure might be crashing at night. Fluid might be accumulating in your lungs. The commonality: your body is stressed and struggling to function. I had a patient, let's call her Dorothy. Dorothy was 76 years old. She came to me saying she felt exhausted every morning. She couldn't walk her dog more than a block without feeling winded. Her daughter had noticed the change. Dorothy had become less active, less social, less like herself. Dorothy thought she was just getting old, but her morning fatigue and breathlessness were progressing. We did a comprehensive workup. We found that Dorothy's heart was failing to pump efficiently. She had congestive heart failure. It was manageable with medication, but only if we caught it early, which we did. If Dorothy had dismissed this another year, her daughter would have found her having collapsed. Instead, we adjusted her medications and Dorothy got her life back. She's walking her dog daily again. She's visiting her grandchildren. That's the power of paying attention to what your body is telling you. How to assess your own breathing. Here's a self-assessment. When you wake up tomorrow, rate your breathlessness on a scale of 1 to 10. 1 is no shortness of breath. 10 is severe. If you're experiencing a 5 or above, that's worth mentioning to your doctor. Also note, do you feel short of breath lying flat? Do you need to prop yourself up on pillows? Do you wake up gasping for air? Do you feel your heart racing? Do you need to sit on the edge of the bed for several minutes before you can stand? These are the key observations. What to do if you're experiencing these symptoms. Now I've given you 5 warning signs. Some of you might recognize one, some might recognize multiple. Here's what I need you to do. Don't panic. These aren't death sentences. They're your body saying, hey, something needs attention. Here's your action plan. Step 1, write it down. For the next week, document when these symptoms occur. What time? What were you doing? Did anything make it better or worse? This information is gold. Step 2, call your doctor. Not next month, this week. If it's emergency symptoms, severe chest pain, can't breathe, passing out, call 911. Step 3, bring your journal to the appointment. Bring a list of all your current medications and supplements. Bring any questions written down. Step 4, ask for testing. You have the right to ask for blood work, an EKG, a sleep study, or whatever testing your doctor recommends. Step 5, get a second opinion if you're not satisfied. If your doctor dismisses your concerns without doing proper investigation, get a second opinion. Let me tell you why I'm so passionate about this. In 25 years of medicine, I've seen 2 very different paths. Path 1, a patient comes in with one of these symptoms. We investigate, we find something, we treat it early. That patient maintains independence, they stay active, they stay with their family, they enjoy the later years of their life. Path 2, a patient ignores the symptoms. They think it's normal aging. Months pass, years pass, the condition progresses. Eventually there's a crisis, a fall, a heart attack, a stroke. Suddenly that patient has lost independence. They're in a hospital. They need constant care. Their family is devastated. The difference between these 2 paths: attention, awareness, taking your body seriously. These warning signs aren't trying to scare you. They're trying to save you. And the good news, once you know what to listen for, you can act on it. Before I send you off, I need to ask you 3 things. 1, have this video saved, send it to your doctor, show it to your family. 2, subscribe to this channel. We release new senior health videos every week, content that helps you stay independent, healthy, and confident. 3, hit like and comment. Tell me in the comments which of these 5 warning signs surprised you the most. Your comments help me create content that resonates with people who are watching. Let's build a community of seniors who take their health seriously. I'm going to leave you with one final thought. When you're 55, 65, 75, 85 years old, health becomes everything. It's the foundation for independence. It's the foundation for spending time with people you love. It's the foundation for doing the things that bring you joy. Every single day, I see patients who wish they had paid more attention earlier, who wish they hadn't dismissed those morning symptoms as normal aging. And I also see patients who did pay attention, who caught issues early, who maintained their independence and their quality of life. You're watching this video for a reason. Your body might be sending you a message right now. Please listen to it. Please take it seriously. Please reach out to your doctor, and please share this with someone you care about who might need to hear it. I'm Dr. Alex Mandell. This is your health. This is your independence. This is your life. Let's protect it. I'll see you in the next video.